Hi everyone, welcome back to our podcast called The Research Behind Lift the Lid, where we talk to researchers previously funded by Australian Rotary Health about their research findings. I'm Jessica Cooper, and today on episode 17, we will have a chat to Associate Professor Lara Farrell from Griffith University. Associate Professor Farrell received a mental health research grant from Australian Rotary Health in 2009 for her project called A Novel Approach to Treatment-Resistant Childhood Obsessive-Compulsive Disorder, D-cycloserine Augmented Behaviour Therapy. Associate Professor Farrell is a clinical psychologist and Associate Professor within the School of Applied Psychology, Griffith University Gold Coast campus. She conducts clinical research in the field of childhood anxiety and obsessive-compulsive spectrum disorders. Her research includes experimental studies of underlying cognitive mechanisms associated with childhood psychopathology, as well as the assessment, prevention, and treatment of pediatric anxiety disorders and OCD. So thank you very much, Lara, for joining us on today's episode. How have you been lately?
Really well, thank you, Jessica. Thank you for having me. I'm really pleased and excited to be here.
Yeah, it's good to have you. It'll be interesting to talk about your project today. And I know it has been about 11 years now since you were awarded that grant from Australian Rotary Health to look at a novel approach to treatment-resistant OCD in childhood. I guess to start off, can you tell us why there was a need for a project like this?
Yes, absolutely. And thank you to Rotary for awarding that grant. It really was really quite impactful at that time to conduct one of these first studies of looking at D-cycloserine as an augmentation to our current treatments for children and adolescents. And indeed, it was one of the first studies that did examine this approach in kids, and since then has been supported a series of studies since. So we really are very thankful to Rotary for that funding. And really, the importance of it really came about for a need to improve current treatments for children with obsessive-compulsive disorder. And as your listeners may know, OCD is a common problem, and it's a problem that's incredibly debilitating. So it affects all aspects of a child's life in terms of their schooling, their peer relationships, and most notably, the impact on the entire family. So these kids are often incredibly impaired, suffering enormous amounts of distress and huge amounts of interference in daily life. So whilst we have very good treatments for children and youth with OCD, and that current treatment that's supported by evidence is cognitive behavioural therapy with a focus on exposure therapy, exposure and response prevention, whilst it's very good for the majority, there still remains a gap in terms of achieving a full response to treatment. So we have anywhere across our trials of 20 to 40% of children who don't respond fully to our best treatments. So there is a great need for us to continue to improve the current good treatments that we have, as well as develop novel ways and new methods for supporting these children to achieve gains that are going to be lasting and impactful on their lives.
Yeah. So I guess when you did start this project at the beginning, what were some of the initial aims?
The project, the main objective of the project was to conduct a randomised controlled trial, and this was really a preliminary trial to test the feasibility of D-cycloserine as an augmentation to exposure therapy in children and youth with OCD. So the very specific goal was to randomise children to either CBT plus D-cycloserine, which is acutely dosed. So children only receive a dose of this medication immediately before their exposure therapy session. And in this case, it was 5 sessions that involved exposure therapy, relative to a control condition where children received the evidence-based treatment, cognitive behavioural therapy, including 5 sessions of exposure, that they received an identical pill, a placebo pill. So the objective was to assess whether children who received D-cycloserine had superior outcomes, whether we could achieve more responders following treatment and a greater reduction in OCD severity following that treatment relative to children who received the CBT without the pill.
Yeah, it sounds like a very interesting study. I guess what kind of findings came out of this?
The findings were, as we hypothesised, that there was some superior outcomes for children who received D-cycloserine. So children who received DCS relative to the placebo had a greater overall reduction in severity following the treatment out to 1 month follow-up. And this was across a number of different indicators of OCD severity. By the longer term follow-up, at 6 months follow-up, there was no difference between the groups, however. So what the findings illustrated to us, and similar findings with adult patients in different types of studies, is that D-cycloserine appeared to accelerate gains rather than lead to a greater amplitude or a greater magnitude of reduction, which is really important in terms of a condition like OCD that is causing so much impairment on a child and family's life. If we can find ways that we can take our treatments and make them more efficient or help children to achieve gains much more quickly, then often we are preventing that, enormous impact that occurs longer term. So the findings were promising. It was a small pilot study of 17 children who were randomized to those two conditions. We were assessing for safety and tolerability of D-cycloserine, which was supported. And I guess that was the really, exciting thing about this novel approach to pharmacological augmentation, where we're using a drug that was previously used to treat tuberculosis. So it's an antibiotic medication with a very good safety profile. So it's tolerable to children. There's not a lot of side effects that are reported in the literature. Indeed, there are no adverse effects reported in the literature when used in this way. And it's used acutely. So as I mentioned, there's only 5 doses of the medication that are used in addition to the exposure therapy. So the study was important in providing support that D-cycloserine did appear to accelerate outcomes for children who received the DCS relative to placebo. And it also supported that the approach was safe for children, that there weren't adverse outcomes, and the study was overall assessed as being feasible.
Yeah, so I guess you said this was quite a novel approach, so it hadn't really been done before. Was this, I guess, the first of its kind, this kind of study?
Yeah, at the time there had been a number of preliminary basic science studies where D-cycloserine had been tested in rodent samples, looking at whether D-cycloserine could enhance extinction learning, the experimental analogue of exposure therapy. And there are a handful of studies with adults supporting that DCS did appear to be associated with enhanced exposure therapy outcomes. At the time, this was only the second study that was published with children and adolescents with an anxiety-type presentation. And it was the first in OCD looking at a severe and refractory sample. So there'd been one previous study with children with OCD, a pilot study published by one of our colleagues, Professor Eric Storch in the US, and he found no advantage or no better outcomes for children with D-cycloserine relative to the placebo. So in our trial, we were interested in finding out whether it might be more applicable to children who've had a failed response to exposure. So we were really looking at improving those outcomes for children who were not gaining enough from exposure therapy in previous treatments that they'd had. So ours was the second study in a child and adolescent sample, and the first to look at this more severe and treatment refractory. And with our findings showing significant effects, it was similar to Eric Storch's study, which found large effect sizes, but they were not significant. So we were finding similar trends in terms of our outcomes, that D-cycloserine appeared to have favourable outcomes. However, it seemed to be stronger in our study with these children who perhaps were more resistant to therapy, had had exposure before, had more severe OCD perhaps, and we did achieve stronger outcomes. And, and that's been, I guess, an important finding from our study, that from a range of pilot studies that occurred around a similar time and following that D-cycloserine isn't a one-size-fits-all. It isn't something that we can give to all of our patients and achieve much greater outcomes. What it seems to be is it seems to work under particular clinical parameters, under particular dosing parameters, whether it's dosed before versus after therapy, and under certain conditions and perhaps for certain patients. So I think our research, provides a little bit of evidence that perhaps this might be reserved for children with more severe or refractory treatment-resistant OCD, and certainly that's aligned with some of the other findings in adult studies as well.
Yeah, well, that just shows how important it is to keep conducting research, because, it's not one size fits all, and, so many people respond to treatments very differently. So, yeah, it sounds like that was quite an important study for people who don't respond well to treatment. And
yes, absolutely.
Yeah, I guess, did these findings also lead on to some further research, or has there been any important implications for clinical practice and helping real children who have this disorder?
Absolutely. I think the opportunity to conduct this really important pilot work here in Australia and with children and youth with OCD really then helped us to find some data to support the feasibility, to show that this might be a really promising way forward. And from there, we received funding from a number of different sources following that trial. So we were funded by Griffith University to conduct a similar trial with children with phobic disorders. We were also funded subsequently by the Australian Foundation for Children to conduct another study of D-cycloserine for more intensive treatment. And then, that resulted in a large NHMRC funded trial, which has only recently been completed. Actually, last year we completed the 6-month follow-up. And the clinical implications are that this has led in the past 10 years since we were first funded by Rotary in the treatment of nearly 200 children and families with different anxiety disorders who have been able to come in and access evidence-based treatment by way of exposure therapy, with the majority of children receiving and showing really favourable outcomes and a very good clinical response to treatment, and also the progression of a number of scientific studies to help us advance our understanding about how D-cycloserine might help children in treatment, but also support for other ways and approaches to augment our treatments to improve outcomes.
Yeah, well, yeah, that sounds amazing. Like such great results have come out of this research, and it sounds like you can go so much further with it as well, and keep on improving it. So, yeah, that sounds really good. And I know that it's Rotarians. They put in a lot of hard work to fundraise for mental health research, much like yours. And I guess I was wondering if you might be able to let them know just how important it is to continue funding mental health research.
Yeah, absolutely. I think, mental health remains one of the most prevalent yet burdensome problems faced by children and adolescents and families in Australia. And whilst we do have plenty of effective evidence-based interventions out there, sadly, we're faced with a major problem in a gap to service provision, where we know that in Australia, only about 2% of Australian families will receive effective evidence-based interventions for their mental health problems. So we need to do much more in terms of understanding how we can improve access to these interventions, but also improve outcomes for those that are only, demonstrating a partial response to these current best treatments that we have. So there's, a long way to go in terms of improving our precision in terms of mental health interventions, and also actually having an adequate reach to the families across Australia who are needing it. So it's enormously beneficial to have programs and organisations such as Rotary who put so much investment into mental health research, and I think, make an enormous difference to the children and the families in Australia who need it most.
Yeah, well, it's been really great to talk to you about your research findings today, Lara. And I guess just before we wrap up today, was there anything else that you wanted to add?
Only thank you again. Thank you to Rotary for, the public awareness that you raise in terms of mental health, the support that you give to science in Australia, and for the dissemination of the research findings like you're doing today through this interview. So just really thankful to Rotary for all that you do in Australia for mental health research.
Yeah, well, it's always great to hear from our researchers and, to see where that funding has gone and, the results that come from it. So thanks again for joining us on our podcast.
Thank you, Jessica.
Well, that was the 17th episode of our podcast called The Research Behind Lift the Lid. It is always so inspiring to hear what researchers in Australia are doing to make a difference to mental health and how they are helping us on our mission to lift the lid on mental illness. If you can, please continue supporting important research like Lara's by donating to the Australian Rotary Health website. Thank you for listening. Please join us again next time.